Do you remember your hand shaking at any point?
Yeah. Patient is RSI'd via cricothyrotomy. Repeat, he has been criked.
Welcome to Medic Mindset. This is Ginger Locke, and I'm working to make the podcast I wish existed when I started poking around in the world of EMS podcast. The ingredients I tossed into this experiment are humility and humor and introspection. And the guests come to this encounter with one thing in mind. They want to share their experiences, good and bad, so you can grow from them. And from the intro teasers, you may have figured out what this one's about. I'm thrilled to have caught up with a medic who was willing to share his experience of performing a surgical airway. Unlike other episodes, this is a detailed account of that one call. He was tough to round up. We literally met at a dive coffee shop on the side of the road. So listen in as his story takes center stage, despite planes, trains, and automobiles literally going by. We're both having our coffee. Yours looks like tea, though. What kind of tea are you drinking?
Mint.
Mint tea.
I've had enough caffeine to kill a horse today, so.
Yeah, mine is decaf, so. I'm lucky to have caught you because you're just in town for a bit, and I'm happy to be face-to-face with you and talk through something I've wanted to talk with you about for a very long time, and it's finally gotten a chance to round you up. So this guest had an opportunity to do a very low-frequency, high-acuity skill. He did a surgical cricothyrotomy, and I know nothing about the case, so I'm hoping to kind of hear the setup of the case. What was the indication for the procedure? I really want to pick into, if you can remember, your thought process during it and feelings of hesitation or nervousness. Obviously, everybody would be interested in the patient outcome, but in particular, I want to pick through just kind of your mindset as you were going through the procedure. We talk a lot about these procedures that the hardest part is pulling the trigger to actually do them. But I think this procedure is actually, the procedure itself is difficult or can be challenging. So talk to me about it.
The procedure isn't, as far as level of difficulty, wasn't any more difficult than being taught it in the program. The instructors that showed us that skill that day or in school were, this is how you do it, this is what you do. The surgical crike kit that we were shown in school was the exact same kit that we had on the ambulance. When it came time to perform the skill, I reverted right back to being taught the skill.
Okay.
Just worked.
Good.
Thank God.
Yeah. Well, can you tell us a little bit about the indication, what was going on with the patient that you elected to do this?
It was a structure fire call. My partner and I arrived on scene and were able to identify the patient that we got into the back of the ambulance with. He was burned. We field guessed it at 80 to 90% second and third. It was verified by the hospital at 80 or 90% third degree. We got him into the back of the ambulance. The patient walked to the ambulance.
Oh, wow.
And neither my partner and I realized how badly injured he was until he was walking past us. And we both just had that look of, oh, crap. And game on. Start going to work. I was able to keep him calm, establish IV access. The one part of his skin on his arm that didn't slough was his AC. I got the IV, started administering pain meds, and moved forward from there. My partner and I both identified the typical raspy voice of someone that had high temp inhalation, airway burns, and we together made the call to RSI.
And to set the stage, was this partner paramedic level provider?
Yes.
On that day, how many years experience did you have and did he have?
I had been, I'd say, 3 years experience for myself, and for him probably 2 or 3 years.
Okay.
Having the dual paramedic on the truck I'll say it helped a lot on that day, because we both looked at each other, we both simultaneously recognized the problem and what we had to do. Before I was able to say, hey, let's do this, I already had my RSI drug sliding across the countertop to me to be drawn up. And I started working on med dosing and my partner started working for the intubation, started working getting the ET tube ready and the laryngoscope, and working towards getting set on his end. And as I administered the drugs, we administered them, waited a second, and he went for the attempt. Due to positioning of like where we were sitting in the ambulance during the skill process of RSI the patient, it was just easier for me to assess breath sounds and epigastric sounds, and I noted that he heard a gurgle over his belly, and there was nothing in his lungs. So I went for a second attempt, same outcome.
Can I back up to when you guys sedated and paralyzed the patient? Did you tell them what you were doing, or did he start declining in front of you, or was he awake enough for you to say, "Hey, this is what's going to happen"?
He was awake enough for us. When he got into the ambulance, he was like, "It hurts, man. It hurts." Mm-hmm. And it was okay, dude. Don't worry. We're gonna get you out of pain. Started administering pain meds. Asked him about his breathing status, and he answered the question that no one wants to hear, which is it getting a little bit more difficult to breathe? And he said yes, and that's where it was a snap of the fingers. Okay, we got to roll. Being taught in the paramedic program, that airways decline rapidly. We didn't want to take any time.
Yeah.
And we told him, "You're going to take a nap," and we just started administering the medications and moved from initial pain med dose that we were trying to help him with to the RSI drugs, to doing the intubation. After 2 attempts by my partner, we were able to round up a firefighter rider with us.
So you're sitting still at this point? You haven't rolled?
The first 2 intubation attempts were done sitting still. I made the call to my partner to get in the front. I knew best possible outcome, I needed to get him to the burn center.
And so walking into this call, you knew it was your patient? Were you guys standby at a structure fire? Or
we were initially called in. It came out as a all-alarm. They pulled in, I think there was 4 fire trucks. And then our ambulance was the first in.
Okay.
The second ambulance was on its way up. And we made patient contact. Said, we have patient contact. We requested a second unit. The second unit made patient contact immediately also with one of the individual's friends, and they were working on that individual in the back of their ambulance.
Okay, so to go back to the question, I think I interrupted you when I was asking if this was, you knew this that you were up for the next patient, or how did y'all decide who was going to care for this patient?
It was a matter of where I was sitting.
Okay, yeah. I mean, sure.
We hadn't had a extravagantly busy night. We just, it was like, I'm here, let's do it.
Okay.
And what it was our system has you get 2 attempts and someone else.
Right.
And because my partner had done 2 attempts, I was going to move up and try to go for the tube. He got in the front. He started driving. I went for the 3rd attempt of intubating the patient, and as I go in for that 3rd attempt, I watched the airway start to close.
Yeah.
And when I saw that, it was like, explicit words were flying around the back of the ambulance like water. And
you had a firefighter back there with you?
Yeah, I had a firefighter with me. I don't know. I guess I could call it instinct. I know the layout of my ambulance, and my hand went back. I grabbed my crite kit, brought it down forward, and started opening the crite kit. And again, I was lucky to have the same crite kit I had been taught in school, and I just reverted right back to what I was taught in school. The only difference is that when we were taught in school, we were taught to position yourself at the patient's feet, use a downward angle.
Yeah.
Well,
you were at the head.
I was at the head, and I still did everything the same direction, and I was surprised at the minimal amount of bleeding.
Yeah, I was starting to put it together that maybe with those burns, it maybe had been 3rd-degree burns. It may just not have bled. It had been leatherized.
He was sloughing pretty well. It wasn't full thickness burn. As far as bleeding, maybe 5-10 milliliters. That's it. I mean, it's very minimal. Finding the landmark was easy because he wasn't a very, very thick-bodied person. He was a frail person.
So what landmark did you go looking for first?
Went for the Adam's apple. Found the cricoid cartilage. Went for the notch for the membrane. And once I had everything lined up, cleaned the site, made the first vertical head to toe.
I call it north south.
Yeah, I mean it's like he was laying down, so the vertical incision that you do. Again, I was expecting more blood. Punctured the membrane.
So did it take? You're using a scalpel.
Mm-hmm.
Did it take more than one incision?
If I remember correctly, I did 2 passes. I did one to get through the epidermis, and then there was a very thin sub-Q layer that I went through, and then I could clearly see the cricoid cartilage and the membrane, and just punctured it through.
The puncture that you made, was that more east-west, if you will?
Yeah.
Horizontal?
Yeah.
Okay.
And it was the puncture of the membrane east-west, and then the crite kit that we used has the little hook piece to it. I remember the instructor that showed me the skill telling me, you're never going to use this. And we didn't use it at school.
Yeah.
And I used my pinky, and then I flipped the scalpel around and used the butt into the scalpel to maintain patency of the hole that I just made. I grabbed the trach and just dropped it in and was able to secure it.
So y'all had a trach. I wanted to ask what size ET tube you had used, but you had something commercial device.
A commercial device, yeah. It would be the equivalent of about a size 6. I mean,
cuffed.
Cuffed, yeah. And it has a little stylet in it, and you pull the stylet out, and the firefighter I was with, very skilled firefighter, knows his job. He's patched at the basic level. He knows get the bag, get it on, and he knew exactly what to do as far as his rate, his depth, and I was able to have him secure the airway. Once I had it established, I was able to have him secure it while I was monkeying around with the shrink wrap that they had put on the ties. I couldn't, because of the blood and the fluid on my hands from the bodily fluid on my hands, I couldn't pull it off. And so
this is like a wrapper you're trying to get off?
Like a shrink wrap.
Interesting.
It's like they balled up the end of the cord and shrink wrapped it, and I couldn't pull it off. My fingers kept slipping off it, so I had to resort to using my pocket knife to take the plastic wrap off so I could secure the tube. So,
and the securing device was like something that wraps around?
Shoelace.
Yeah.
For lack of better terms.
Right.
Shoelace.
Okay. Do you remember your hand shaking at any point?
Yeah. It was once I did it, once I completed the skill and had it secured, the realization of what the hell I just did hit me. And I was like, oh, okay. And my partner, who's now tearing towards the hospital, I to this day I don't know why I said it, but I yelled to my partner and said, we're criked. And once the call was over and done with, he was like, I felt my rectum hit my throat. And I didn't realize at the time that we had a rider. We had the guy's wife with us, and I didn't realize that.
Front or back?
Front.
Okay.
It was absolute perfect scenario. She stayed. When I stuck my head up and I said, hey, look, I'm the one caring for your husband. I asked her, when we get to the hospital, I need you to stay in the ambulance and let us work. I will come back out and get you.
Right.
And that was
a smart move.
I was blown away that she stayed in the ambulance.
Yeah. People just need direction.
I've never had any other patient listen to me like that.
Yeah.
So it really floored me. But we re-administered sedatives and pain meds. And
how long of a transport?
Where we were to the hospital, I would say a normal day, non-code 3 driving would be the 40-minute transport. Calling in the report was probably the calmest report I've ever given. I've done cardiac arrests and been just worked up beyond belief calling in a report, especially when I was brand new. This report was, okay, I've got to get my information across, concise, clear, tell them what is coming to them.
Do you remember what you said?
I explained to him who I have a thing, I always tell them who I am.
Okay.
And I tell them who I am, from what agency, what unit, this is what I'm bringing you. And it was, I told them I'm bringing you a male that has been involved in a structure fire. We've got burns to 90% of his body. Patient is RSI'd via cricothyrotomy. Repeat, he has been criked. I do remember that earlier in the call, in the time it took to try and intubate him, to let's get going, to when I sat down to try to do the third attempt at intubation, I noted that he had started spontaneously breathing. We had to administer the second paralytic to keep him down to do the skill.
So when you say 80 to 90% burned, I think about that's got to be circumferential chest. Is that true?
He was burned circumferential chest, arms, legs. I mean, there was patches of non-burned.
Yeah.
I mean, we field guessed it at 80 to 90. Mm-hmm. Like I say, the doctors confirmed 90.
Wow.
And it was confirmed at third degree burns throughout. There wasn't no second and third degree. The doctor was like, no, that's all third degree. We had established fluid administration using Parkland burn formula. With the amount of burn, it was just a matter of, hook up a bag and let it go.
Oh, yeah, for sure.
And covered him up with burn sheets. And, when we got to the hospital, it was... I mean, I've gone into our local level 1 trauma center and been fairly impressed. You go in, you have 5 people in the room. Rolling into a burn center like that and having 20 people in the room was, what the hell?
Yeah.
I mean, I remembered one of my instructors saying, when you give your report, when you go to this hospital, speaking about our level 1 trauma center, you let your partner and the nurses get them off the stretcher. You stand back and you talk loud, and if they don't hear you at the end of the hallway, you're not doing it loud enough. And that's what I did. It was an interesting, it's a good way of putting it, an interesting call. I look back and it's when I've been asked, why did you do that? I said I had very few options. I had do nothing and let him die.
Yep. I
had perform the skill, mess it up and let him die, or I had perform the skill, perform it right, and hopefully save him.
That's right.
You don't have very many options at that.
And we do, and I say we, but I've not done a surgical Craig, but I've seen patients come in with these types of high acuity, low frequency skills, and so many medics and emergency physicians say, you can go your whole career never doing this. And
I've heard that multiple times.
I think that's a dangerous mindset because you need to be prepared to do it. And sometimes people think because it doesn't happen often, they think maybe it didn't need to happen. Did you get any response of like, he didn't need to do that? Or
No. I delivered my patient to the burn center immediately upon saying, look, here's my report. I went out, got the patient's wife. I took her to the waiting room and I introduced her to the doctor and to they had the chaplain out already because of the severity of the gentleman's injuries. Yeah. I was getting signatures on my run report, and as I went to leave, I remembered that I forgot to get a signature from his spouse. Went back in to get the signature. As I was walking back out, an individual that worked at the hospital stopped me and said, hey, the doctor wants to talk to you. Mm-hmm. The question of did you get any flack for doing the skill, I immediately, when the back of my head go, oh crap, here goes my career. Here goes my job. I messed it up. I did something wrong. He walked me over to the doctor, and I don't know a word to describe how I felt when the doctor walked up, extended his hand, introduced himself, and it said strong work. Not what I was expecting. I was expecting, like, dude, why did you do that? You didn't need it. You could have intubated him, and it was 180 of what I was expecting to hear out of this doctor's mouth, and I was just like blown off my rocker. The level of professionalism in those few words told me that, I did it right.
Yeah.
I did the skill. I did what I had to do for my patient. Mm-hmm. So
I'm glad that he did that.
Yeah.
And that's a message to paramedics. We are leaders also, so when we get patients handed off to us, it is important to take that second to tell people they've done a good job, because everybody's kind of wondering, am I doing okay?
Or the bystander that pulls the individual out of a car to...
Perfect example.
And then says, was I right in doing it? It's like, I mean, you felt you needed to do something? You did right.
Right.
The reality slowly took hold of the call, and, started getting feedback through social media on the individual, and started following on social media and following his recovery. Got a text from my partner that he was also following, and he said, well, our guy just passed. I mean, it was like we were, following along, like, wow, man, this guy's going to make it. He's going to make it. He's going to make it. He's 30 days in, 40 days in, 50 days in, 60 days in. And on day 66, he's succumbed. I say his batteries just died.
Yeah.
His batteries wore out. He couldn't go anymore.
Mm-hmm.
But, there's the part of you after your patient dies that, did I do the right thing? Did I truly help him? And
I wonder if he was talking in those 66 days.
He, according to what I read and what we were told, he was able to start humming. There were points where they had him off sedation to the point where he was able to look around the room, from what I understand. I never went to the hospital to do a follow-up. I relied. It was one of the, it's not my place. It's if I run a call and my patient's still in the ER when I do my next return, I'll stop in the room and say, hey, how you doing? Are you feeling better? But I didn't feel it was my place to go down and keep asking. So I just followed along on social media and kept up with it in that manner.
Good work.
Definitely the single most interesting skill I've done in my 4+ years now.
Anything about the call that still bugs you?
No.
I love that.
No.
That makes me happy for you.
People always say, "Oh man, do you have dreams? Do you have nightmares? Do you have?" Mm-hmm. And I don't. It's knowing that I did right by my patient, and knowing that if I hadn't done it, it would have been a totally different outcome. It's all I needed. You can't be afraid to do your job in a case like that, because something that serious, if you are afraid to do your job, you're not acting on the patient's behalf at that point. Your number one job is to act on the patient's behalf, and no matter the situation. So
I think a lot of people on that call, they hesitate, and they hesitate all the way to the hospital, and they monkey around in the orotracheal world, and they don't get it done. And that's the reality. And so your mindset was, I'm going to get an airway.
Moving from trying to intubate to going for a surgical crike was solely on watching the airway close. It was, oh crap, and instinct took.
Was it swelling?
It was swelling. It was. I don't know how to describe it. It was like watching someone squeeze a garden hose. It was just. It just shrunk down right around. And it was surreal because going through school and the way that it was all explained, and you're going to hear raspy voice, you're going to hear stridor, you're going to, and when you are intubating, if you don't get the tube and you're watching it, you can actually watch the airway close, and then being able to see that firsthand. Everything you read in the books about the airway swelling and closing off, they're not writing a fictitious story in those books. That's exactly what it looks like.
Did he have facial burns?
Yeah. His facial hair was burned, and it was weird that, he was so badly injured that, I mistook his skin color.
Two things. One, any advice about the procedure? The way you did it is the way it's recommended.
With the exception of being at the patient's head versus the foot. That's the one thing I will say that, yes, I know I was at the wrong end of the patient. Again, when you're in the back of an ambulance and speeding.
You did it en route.
Yeah.
I'm just going to digest that for a minute.
I was told by one of my coworkers, who is a very, very skilled and, in my book, a very well-respected paramedic. He's been doing it a long time. We were talking about the call, and he looked at me and said, I would have pulled over. He goes, same thing. The person said, wait a minute, you did it en route? And I was like, yeah. And he goes, this individual chimed in and said, I wouldn't have. Mm-hmm. I wouldn't have done it en route, because the relationship I have with this individual of, snip back and forth, like everyone has that individual that they like to give crap to.
Right.
When he said that, I just snipped right back. I said, well, it got done. Mm-hmm. And the thought process of saying, "Hey, pull over."
Right.
That one thing never entered my mind.
Had you ever cut through someone's skin before with a scalpel?
No, but I'm a fairly avid outdoorsman, fisherman. I hunt. Blood has never bothered me.
Well, blood doesn't bother many paramedics, but cutting through skin bothers people, I think.
Yeah,
but maybe you're fishing and things like that.
It didn't feel any different. It didn't feel any different.
Right. I think that's an important piece of your story is that you're handy with knives.
I don't even think the fact of handy with knives is just having the experience of cutting, flesh.
Have you cut animals? Yeah. See, I think that's important.
Yeah, I just
did it.
For lack of better words. Yeah, I just did it.
Get your mic a little closer.
Oh. First time with a mic in my face.
Hey guys, one last little bit before you go. I've got to direct you to the show notes on this one. Go to medicmindset.com, look for episode 7. I've linked to a video that you should not miss. It is of a emergency cricothyrotomy. You can get a sense of how much blood is really involved in the process. That video will probably help you prepare for it, so you shouldn't miss it. Check it out. So, picking up the train.